Following a new federal regulation, many Oklahoma hospitals have begun posting prices online for every service or item they offer. Paul Monies with Oklahoma Watch has examined these price lists and is here now to fill us in on just what kind of consumer menu is available. Paul, thank you for being with us.
Well, thanks for having us.
Well, I understand you've taken a good hard look at the price list from some of the largest hospitals in the state. What's your takeaway?
That's right. Yeah, we the takeaway is basically just how confusing all this healthcare pricing is. You know, if you're lucky enough to have private insurance, you know, you kind of see that bill after some procedure or some kind of surgery or something, and you look at it and you're like, wow, that's a lot of money. But what you're seeing here in these price lists is actually the raw prices that the hospitals are posting before insurance takes deductions or before, you know, a government insurer like Medicare or Medicaid will do it.
Do you think consumers will have sticker shock if they dare to go look?
I think they will, yeah, because I mean, some of these prices are astronomical. I mean, you know, healthcare is expensive and it costs a lot. Obviously, people know that, but it's, you know, it's beneficial in a lot of ways. It's keeping people alive. But some of these raw price lists that range from, you know, $800,000 for surgery to, you know, all the way back down to a couple of dollars for some gauze pads.
Yeah, it could be something to help us be healthier. You see how much that's going to cost.
It could give you a heart attack too, I guess, maybe if you just look at it that way, yeah.
How accurate is this pricing?
Well, I mean, this is kind of the big thing. None of this stuff is standardized across hospitals. So they're all posting their own description of these procedures and surgeries or whatever else in their own way. And it's all very kind of convoluted. Each hospital I looked at that posted this, they're all posting big disclaimers essentially saying, you know, this is probably not the price you'll pay. This is a price on our price list, but, you know, your results may vary.
Okay, are all hospitals doing this, not just the big ones?
They are. I mean, we did look at every single hospital. There's about 100 hospitals in Oklahoma that would be required to do this under the Act. But we kind of took a look at the biggest ones in Oklahoma City and Tulsa areas, and they're all doing it. They're not all, you know, excited about it. Sometimes it's buried deep in their website, but it's there.
Well, this is something I think that hospitals have resisted. First of all, why would they resist doing this?
Well, they come out and say, well, nobody ever pays these list prices here, which kind of begs the question, why even have them in the first place? I mean, they're basically the price you would get charged if you walked in off the street without any kind of insurance, cash price. But of course, there's a lot of cost shifting goes on in healthcare. People with insurance are paying for some of the uncompensated care. People that can't afford it and come in the door and get treated. And so, you know, the government has said, well, we want to have a focus on price transparency, the Trump administration especially, but this also goes back to the Obama administration too. And so hospitals are kind of reluctantly going along with some of this stuff, but say it's not really reflective of what they're regularly charging patients.
Are there those who will fall through the cracks, though, who don't have insurance, who don't have Medicaid, Medicare? Is there a danger that someone's going to have to pay these absolute prices?
I mean, this is, sometimes you get charged these prices if you're out of network, and that's, you might get a surprise bill, which has been one of the things administration and other administrations have been trying to crack down on, you know, kind of get that extra bill at the end of a procedure that you wouldn't expect to come. Yeah. And it's an out-of-network doctor or some other service from out-of-network out of your insurance company. And so some of that, you know, definitely could be falling through the cracks. Obviously, if you're don't have enough money, don't qualify for any kind of Medicaid or Medicare program, you could be ending up paying some of this, but the hospitals will say that they try and negotiate each time, and so you won't probably pay that full price each time.
All right, folks can learn more by checking out your article in Oklahoma Watch.
That's right.
Thank you for being with us.
Thanks for having me.